Welcome to Clifton Health On Air. I'm your host, Danielle. And with me today is my co host, Lauren. And today is Friday, October 25th. And this concludes the National Health Education Week podcast series. Today's topic is workforce development, growing the pipeline, and exploring career options in public health. And today with us, we welcome Jennifer Kidd, Project Coordinator of the Clifton Health Department, and John Biegel, Health Officer of the Clifton Health Department and Little Falls Health Department.
Thank you for letting us be here today. Appreciate
Welcome.
it.
Hi.
Hi, thank you both for being here today. And can you tell us briefly what your role is at the Health Department?
So I'm the Health Officer and Director of Health and Human Services for the City of Clifton. The Health Officer specifically for Little Falls as well. So I'm in charge of our budget that we receive approval from the Mayor and Council. And then I'm also in charge of all the divisions within the Health Department. That includes environmental, lead, administration, health education, nursing, animal control, and our new division is social services.
So, as project coordinator, my primary responsibilities revolve around accreditation and achieving national public health accreditation from the Public Health Accreditation Board. And as some of you know, we did become a nationally accredited health department last November, so we're coming up on our 1-year anniversary. And then, along with accreditation, I also spend a lot of my time managing our grants. We have a lot of grants that help support the health department, and I spend a lot of my time managing those grants through reporting and also through programmatic efforts as well.
Awesome. Thank you so much for sharing. And you two are the best to talk about workforce development and careers in public health. So let's dive into kind of what is the workforce in public health and what does that look like?
So, workforce development in public health is making sure that we create, sustain, and retain a viable public health workforce that can meet current and future needs. We lost a lot of the public health workforce due to the COVID-19 pandemic. I've read that as much as 20% of public health workers left the field due to burnout and other issues related to the COVID-19 pandemic. And so now more than ever, we need to make sure that not only are we hiring appropriate candidates for positions in public health, but that we also retain these people in the field, which can be challenging.
It can be very challenging, especially as an administrator. You know, you want to try to keep these individuals. And, from experience, the pay is not really why you go into public health, right? I mean, sometimes you could go into lucrative positions, but for the most part, it's medium, if you want to say, and it's challenging. It's really challenging to keep that workforce going and motivated. And unfortunately, we lost a few individuals because this is a good starting ground in Clifton, but the pay somewhere else might be, especially private, is definitely more competitive than what public is. So, like Jennifer said, is sustaining, and funding is a big part of it, which I'm sure we're going to talk about in a little bit.
Yeah. So for those pursuing a public health major or are currently in getting their degree in undergrad or master's program, what kind of tips would you give them if they wanted to pursue a career in public health in specific divisions?
Well, for anything that you do in life, you really have to have a passion for what you do. So if you're going into any position, especially public health, and you want to make $1 million, that's not going to happen.
Right.
Right. You have to go, and we talk about this all the time within the Clifton Health Department, is that you want to try to make a positive difference in someone's life. And sometimes it's challenging because you don't always see the fruits of your labor. For an example, if you go do a food inspection, the goal of an inspector is to educate the restaurant owner, right? That's the goal, and to make sure they put the education into practice. Now, hopefully no one gets sick from that facility, but we don't know, the fruits of labor. The only time we find out if somebody's, is sick, maybe that something didn't go wrong, the education didn't get through for some reason or another. So that's why they call the public health the invisible shield. And it's so true because when everything's working perfectly, it's invisible. Public
Right.
health is invisible. But, when we had the pandemic, who was in the forefront? Public health.
Mm-hmm.
So it's something that's very challenging, but you have to stay the course and know that you are making a positive difference if you're doing the things correctly.
I think if someone is truly passionate about public health, like John said, it's really important that they take advantage of the internships and volunteer opportunities that their school makes available. Partnering with the academic arena here in Clifton is so important to John and the rest of the staff here at the health department. We always have interns from our local universities, and it's just so important that they get a feel for what we do in local public health and to see if it's something that they want to do, because public health is very varied. We are just one sector. There are many other things that people can do in public health, and I think a lot of people don't realize that. A lot of people, don't really understand what public health is.
Exactly. Can you? What are those sectors?
Some other types of. So people take on administrative roles in hospitals, and a lot of hospitals have population health departments, and so they do a lot of similar work that we do in terms of assessing and planning. So that's one area in public health.
I would like to piggyback on what Jennifer said. And education, whether it be colleges, universities, even high school, it's so important to have proper professors or doctors or teachers talking and discussing what public health is. I have the fortune of being an adjunct professor at Montclair State University for the last 14 years. And to be honest, just when I teach about public health, I have had students that we have hired because they have shown that they had the interest and the passion. Lael, Hawani, our health educator, Toyne, and Matt, and Casey,
yeah.
all students of mine that have shown the love for public health and the importance of public health in what we do.
Yeah, and also another area that often gets overlooked in terms of public health is advocacy. There's a lot of work to be done in advocating for various public health issues, whether it be at the federal, state, or local level. So that's another very important role that people can play in public health if they're not looking to go into local public health at the governmental level.
Yeah, right. In our organizations, NHEW and NACHO.
And American Public Health Association.
So there's definitely groups out there fighting for us and getting the word out about public health.
John, you already talked about it, but let's dive a little bit deeper. What are some challenges you see in the public health workforce?
Sustainable funding.
Yeah.
Right? Sustainable meaning over a long period of time. We were fortunate enough, following and during COVID, to get funding to help us increase the workforce, and besides other logistic items, but funding the workforce, that was our key. With the funding, we created a whole new division, social services, within the health department. Need it for a long time, but we had the opportunity. We hired 3 people. They're in charge of our unhoused population, our special needs population, children's mental health, adult mental health, senior mental health. So all those things that we were touching on before couldn't really get that whole message out there, if you want to say. Now we have qualified individuals doing this job, which that's how it should be. And that should be for the rest of, as long as the health department's around, that should be there forever. We also started a lead division because of a law that came into being. And that's, if you look at public health and lead, we used to use our children as canaries, where in public health, it's usually prevention, right? We want to, before you get sick, we want to interfere and intervene. But with lead in children, we waited for the child to get a high lead level, and then we would enter. Now with this new law and with this new division, we go out to rental properties, and we do not only visual but wipe sampling of lead dust, wipe sampling, to make sure that there's no lead dust on the floor or coming from the windows or from the doors. So hopefully that would prevent children from getting sick, right? But in overall, it comes down to money. We're lucky enough to have administration and our mayor and council. They are advocates for our health department. And we are lucky to have that because not all towns are lucky to say that. But I have to say we have been supported by our mayor and council and definitely our city manager, Nick Villano.
You as a health officer, or you both as kind of representatives of the health department to the administration, if the administration says just apply for more grants, why can't you just apply for more grants? Why is it so important to have a sustainable funding for public health?
Well, first of all, there's not too many more grants out there, right? So that's one
We
of
have
them.
almost every grant
Yes.
that you can
Right.
have.
If you tell me where there's a grant, we will apply for that grant. But it's important because of the work that we're doing.
Yeah.
And again, the mayor and council sees what we're doing, right? They get our reports on what we do as far as food inspections, going out to the schools, the Board of Education with the mindfulness classes. They know we run the Code Blue. That's the warming center that anytime it drops below 32 degrees, we have to get people out there, and we get Nate King is in charge of our warming center, and we have to get our unhoused population in there. So all those are just a few things, right? We all have the clinics, the immunization clinics, health education throughout. So we have to be visible, right? We have to be visible out there. And when somebody complains, I always say this to the inspectors, right? If you receive a complaint, environmental complaint, it might not be that important in the scheme of things, but for that individual, it's the most important thing that is going on in their life, and they want a response, and that's what we have to do. We pride ourselves on calling people back within a timely manner. That's one of our quality improvement plans, but that's what we have to do. We are here for the community, right? We are here for the seniors. We are here for the children. We are here for the adults. Doesn't matter what religion, anything. We are here for them. So we have to make sure that we're out there and spread the word of public health.
Yeah, and I think as horrible as COVID-19, the pandemic was for everybody, there were some positive things that did come out of the pandemic. And I think it did open up, especially with our decision makers and our policy makers, I think it opened their eyes to public health and what we do. And just going back to what John had said about the invisible shield, it's a little bit easier since the pandemic to state our cause. When we do need extra funding or we do need to fight a good fight, we can always bring it back to, look at what happened. This could happen again, and how important it is to have a sustainable source of funding. So that's just, hopefully if there's, lessons learned with COVID-19, and there are many lessons that have been learned and that we're still learning, is that, public health is crucial, to our globe, to the world. Hopefully people's eyes have opened to that.
We saw what happens when public health is underfunded.
Yeah.
Right? And that's one of many different professions that were underfunded. So again, it's our job to be the ambassadors for public health.
That kind of segues right into the next question. How can us as a workforce help the future of public health?
Well, I think Jennifer mentioned it, is internships. I, myself, was an intern for the Clifton Health Department a long time ago, like in 1988.
Wow.
You weren't alive.
I
Nobody
was not.
alive. So I was an intern and 20-hour observation student, and I said, this is my hometown. I wish I would love to work for this city. A year later, I had a longer internship, and I never left, right? So from 1989 until now, I've had this job, whether it be from an intern, from a registered environmental health specialist, to health officer, to senior, so it's internships. It's so important. So Nino, our senior registered environmental health specialist, he was an intern. Jennifer Terwilliger, she was an intern. Lael Hawani was an intern. I mean, so we go throughout. There's probably 6 or 7 current employees that are internships. So it's going to the proper internship as well, because sometimes we'll sit down with the intern and say, what do you want to do? What's your career?
Yeah.
And they say, I want to work in a hospital. But they want to do their internship here. I said, well, why would you want to do your internship in a public health department if you want to work in the hospital, the hospital? So we'll help them and guide them to work at a hospital, right? So it has to be a match, because you don't want to be working somewhere for 220 hours, not loving what you're doing,
Right.
and it's not what your future is. So we try to make sure and public health is not for everyone, right? So again, you have to, sometimes I feel, and I don't want to say this, but for most part, I don't feel like I'm going to work every day, right? I feel like it's a different challenge. I love working the people that we work with in our department, right? We sit down, we come up with some crazy ideas, and
We come
We.
up with the crazy
right,
ideas.
maybe me, but like this podcast,
Right.
You and Lauren came to me and said we would like to do something like a podcast, and I loved it. And what you ladies have been doing the last months is unbelievable. For a local health department to do what we're doing is amazing. So keep
Yeah.
it up and
Well,
great
thank
job.
you so much. You're the one who approved it, so thank you. And
I just want. I'm sorry.
Oh, I'm
I just
sorry.
no, I just wanted to just add what John had talked about guiding.
Yeah.
It's really important as mentors and coaches and guides for our newer, fresher public health workforce to show them just how meaningful our work is. I think it's
Okay.
our job to do that. As those of us who have been in the field for 20, 25, 30 plus years, why have we stayed this long? Why do we do what we do? Because we truly feel that our work is meaningful and that we truly are making a difference. I think it's really important to show that example to younger generations every day.
And networking in general, right? There's a lot of, not as
Yes.
much as it used to be, but in-person meetings or
In-person.
conferences, right? That's the time where you meet
right,
individuals.
because
and-
public health is a kind of a small community, or is it really big?
It seems like a small world in New
Right.
Jersey.
Right.
Seem to know everybody.
And it's larger than it was prior to COVID. My
Yes,
concern is
definitely.
that it stays larger, right? Because a lot of the funding is starting to go away. So now the truth is going to be what's going to happen. Will people be losing their jobs, right, because of this? Because the funding is going away, our staff is going away, right? I know for a fact that our administrator and mayor and council do not want that. They want us to maintain the services, right, because it's about services to the community. And they know we provide amazing services to the community. So I would just hope that we continue to have the staff of what we're doing because, we can't afford to lose people, right? Before COVID, when it came to the unhoused individuals, it was myself, not properly trained in social services, and then I would grab somebody, whether it be Nino or Jennifer, and try to deal with that situation.
And now you have trained staff.
We have trained staff, and it's a beautiful thing. We have helped so many unhoused people. Some, in fact, went back to their countries with the help of our staff. Some have gone to rehab and have helped themselves. So we have had a lot of success stories, and if that funding goes away, I'm afraid you're not going to have those success stories any longer. So I just hope and pray that we continue with the workforce that we have.
How would a resident, advocate for public health?
Civic engagement, voting, getting out there, advocacy, so many different ways.
Okay.
Getting involved in what's going on in your community at the local level. And then just doing your civic duty to vote, educating your neighbors and your family members on what's important to you, what public health issues that are being voted on in these upcoming elections. It's really important that people understand how certain laws could affect them and their families. It's just really important to be involved. I think everybody owes it to themselves and to their families and neighbors to be involved and to stay engaged.
Right, and to speak to our local politicians, right? As far as if the health department has provided a service and they're happy with it, because they tell us when they're not happy with something, right? So if they're happy about something, the environmental inspector went and they responded in a timely manner and corrected the problem that they were having, right? Let's get the people to tell maybe the mayor or the council or the administrator, right? Because again, sometimes we hear negative, but we don't hear the positive. And that goes for every
a lot of-
department, you know,
yeah.
police, fire, right, all those different types of departments. So.
And residents had the opportunity this past year to express a lot of their feelings about what health is like in the city of Clifton and what health is like for them through our community health assessment process that we went through this year. Residents had the opportunity to take surveys, to
Yeah.
participate in focus groups, key informant interviews, to let us know what health looks like here in the city. And so that was another way for people to get involved.
And
Yeah.
you were kind of spearheading that process along with consultants.
Yes.
Is that correct?
Yes. So
and
this.
you, Danielle. Too.
Yes,
myself.
and then Danielle. Of
Oh,
course,
well.
don't,
We did
don't
talk
forget about
it.
yourself.
Yeah, we did talk about it on previous episodes.
Great.
And we touched upon our CHA, and some of the key priorities was that Clifton is super diverse, and we have over 60 plus languages spoken. So how could our public health workforce be a help to those people?
So I think it's important when we are hiring and recruiting people and candidates for these positions that not only are they qualified, right, and skilled and knowledgeable, but that they also reflect the community that we serve, right? And that's why we have such the most diverse workforce that we've ever had here at the Clifton Health Department, because that's a reflection of the Clifton community. We are one of the most diverse cities in the country, and we are actually like the top 3 most linguistically diverse cities in the country. So it's really important that the people that work here, you know, look and speak similarly to the people that we serve. And that also helps to build trust among the community. We really want our residents to trust us as public health experts.
We are mindful of that during the hiring process. I know that's one of the things that Jennifer and I look for. If somebody could speak a different language, you know, Spanish being probably the most
It is the most
Prevalent.
prevalent.
yeah.
But, you know, we have somebody that speaks Polish. We have people that speak Italian. So we try to think about that in the workforce because it's important. Like Jennifer said, you want you want the residents to feel comfortable. And that's what we try to do at our satellite office, because our satellite office doesn't look like a government building, right? It's just another storefront. I know our community policing is right next door, but it's an inviting place.
Right.
Over the 2 years, they feel comfortable there, right? That they come in, and we usually have someone that's Spanish speaking because in that area it's mostly Spanish speaking, but you know, and they can relate. So I think that's something that we had to do, is to open that satellite office.
Yeah, I think, yeah, absolutely. And it's a way to grow the pipeline of public health.
Sure.
Yeah. Thank you both for being on our podcast. Any final words? Any resources you would like to share?
No, I just, again, I want to thank you ladies for doing what you do, because this is something that is great. And I know we're going to work on things for next year that's going to be even crazier.
Even better.
But, you know, the goal is always to help someone, right? Whether it be one resident, 2 residents, or every resident. That's the goal. And we want to have a staff that is going to meet those needs. So we want somebody that kind of goes above and beyond for the City of Clifton and City of Clifton Health Department, because that's what we expect.
I just wanted to thank you ladies for coming up with the idea of this podcast, because it's just another way to educate the community about what public health is and what the public health workforce does. So thank you for always advocating and educating and sharing.
Thank you so much. And this concludes our National Health Education Week. And have a great day.
Thank you for tuning in. If you have any questions, you can email us at health@cliftonNJ.org. You can visit our website, www.cliftonNJ.org. Like us on Facebook and follow us on Instagram. Our handle is Clifton Health. And as we do before we leave every day, let us ask ourselves, did you make a difference in someone's life today?